Good afternoon, one and all. We are very happy to have Mr. Arjun with us today to share his experience of the coronavirus attack on him recently. So he'll be sharing his experience. But before that, let us introduce ourselves first. So, Pehchan counseling at Pehchan, it's a mission to help identify yourself, and we at Pehchan help patients and conquerors get them their lost identity. We help them with their emotional support, counseling, and other things. We also help for pain and palliative care counseling. We do a lot of that only. And post pandemic, we have been supporting people with death, bereavement, grief support. Also, disease like cancer, patients are likely to have suicidal ideations. So we help with suicide ideation counseling as well. And also spirituality in counseling, we help with that also. So this is a team of counselors who are doing it. It was started in 2013 and slowly, formally, but counseling was done by me for more than 1.5 decades in the area of pain and palliative care. And recently in August, we have three other volunteers, Malti Rao, Purnima Nadgowda and Vandana Mahajan, who are actively involved in spreading awareness about counseling and extending mental health and support to one and all whoever in the society is needed. We started this initiative of having this webinar to reach out to more number of people in the society, because there is a lot of stigma attached to the disease now. There is so much of COVID scare all around. So that is how we thought, if we have these events, webinars like this, we can actually help people and society at large. So today we have Mr. Arjun, who will be sharing his experience with us. Mr. Arjun is an IIT graduate from Madras and has worked in the oil field in the Middle East. He's a foreign language trainer currently teaching French, German, Spanish, and he's a counselor as well. Has been into counseling people through organizations such as Helping Hand, Banjara Academy, Bangalore, Mental Health Foundation, India, Delhi, and earlier the Medical Helpline 104. So thank you very much for having come here, Arjun, in spite of your hectic schedule. I know it's been very difficult for you to find time for us, but however, thank you for obliging and participating in this webinar. Thank you so much. Over to you, Arjun.
So good evening, everybody.
Yeah, good evening.
And thank you, Alpa, for the very kind introduction. But I would say it is more of an honor from my side to be having this and sharing my experience with the people who are interested to listen to it. And at the outset, I'd like to really appreciate the kind of work that you do. Especially, I'd like to mention one of which, what I've noticed among the several things that you do. For years together, you've counseled in the palliative care at Kidwai, the caregivers as well as the patients. It is something that is truly commendable. Not everybody goes on to do something for years and years. So that is just
thank you so much.
Honestly, mind blowing. Yeah.
Thank you so much.
Yeah.
Thank you so much.
And I wish you the very best. You've recently moved to Mumbai too.
Yes,
and
but
I wish you the very
also
best to continue
helping the patients at Tata Memorial Hospital through cope with cancer.
Yes.
Yeah. So, thank you. Yeah, you can continue. So
yeah.
Shall I start away with the questions, or you'll be?
Sure. So we have the talk today on the experience sharing of a COVID warrior.
Yes.
Okay, so I'd like to first of all clarify that. So yes, I did go through COVID, but when you say a warrior, right? So it is definitely so many more people than just the people who have been directly affected by the corona, right? So when you say warriors, I'm sure we all know lots of people out there who are either frontline workers who have put themselves in the midst of a biological threat and are ready to serve loads and loads of people out there. Okay, so also there's such a stigma attached to it, that the moment you hear that somebody is affected, immediately the person is ostracized in that community, in that neighborhood,
Yes.
which is okay to take the right measures at that point, do all the right measures, but then there's much more that entails after that. So I'll just quickly mention one thing a friend of mine just sent yesterday
Okay.
to just give you a perspective of what warriors could be. I'm sure you all have read, right?
Yes.
So he just mentioned that his brother also had to witness the corona, and so he shares he's in a place called Hashimara, northeastern border with Bhutan and Sikkim. He's
Okay.
serving the Air Force. He doesn't have the luxury of city recoveries. He
Mm-hmm.
heads an Air Force squadron that has 100 plus airmen sick with the flu. The temporary infirmary, let alone quarantine, has limited infrastructure to even inspect patients and limited COVID testing kits. Okay.
Okay. Yeah.
So he's been going to the hospital every day to get his vitals checked, and then in less than 10 days, he had to recover and report back on the job.
Okay.
So this just gives you one little hint at the kind of things that people might have gone through,
Yes.
right? And of course, we've heard about the scale of job losses that have happened in the country and worldwide. This is the biggest threat, the biggest crisis that our current generation is facing, and even bigger than the 2009 recession that we had. That has been the scale in which people have been affected.
Yes.
Okay, so it apparently amounts to certain millions or even crores of Indians who have lost jobs during this phase.
Hmm.
Okay, so it's not only affecting lives but also livelihoods,
Livelihoods.
as you all
Yes.
know.
Exactly.
Yes,
Exactly.
lives and livelihoods. Okay, another instance was an employee working for years is suddenly asked to leave just because the company is facing huge loss. Right,
Yes.
but that is the way ahead. And frontline workers were told to vacate the rented homes. Imagine
Yes.
somebody for doing their duty, saving other people, they're
Yes.
putting their own life in more difficulty. They
Yes.
are being asked to vacate from spaces where other people stay and things like that. Those are the real kind of challenges that people have gone
Are
through.
facing. Yes. And still
Yes,
facing. Still
yes,
facing
yes,
actually.
yes, yes. Yeah, as they say, COVID-19 didn't stop becoming a threat
Yes.
just because we are tired of it,
Yes.
right? So that is still on.
It has its
Okay.
own baggage of threats still coming up
Yes,
actually.
yes,
Every
yes,
time we see it in a different angle actually.
yes. Yeah. So when it came to my case, so I had a few symptoms initially, basically the flu, the cold and cough and fever, and then I started off with some headache and some body ache. The body ache was unusual because I've never typically had anything like that. For almost about 1 or 2 days, it was very severe. I was barely able to move, so I all I wanted to do was rest on the bed. And that is when I heard that somebody close to where I stay also was tested positive. So I thought there's enough evidence to for me to go and get checked at least. And so there was about 2 days of backache, and then I went and got it tested, and then it turned out to be positive. Okay, but then. But what had happened was even before the test or any of the symptoms, I was taking certain things for my immunity, right?
Okay.
Like they say, prevention is better than cure, right?
Yes,
I'm sure
yes.
lots of us are doing things for our immunity. So
Yes.
there was this one thing, a very trusted source, which was the from the Ministry of Health, Ayush, which they come out with these quat tablets and the powder, which you can have with your hot water to keep your immunity up. So that is something I was doing.
Okay.
And but I still, of course, got tested positive. But I got myself admitted in the hospital, and within a span of like 2 days, the symptoms started coming down.
Okay.
So I really think it's because of those, every day taking a couple of times of all those immunity pills, and the hot water, and the powder with all those amazing herbs that we have. So
Yes.
that did a huge benefit. Otherwise, you've heard of people, who've gone through the suffering for many days, and and then there are after effects, and breathlessness and things like that, right? Uh,
Confusion.
so, so that was the case. And initially, of course, there were questions cropping up. There were a lot of things in the mind, the BBMP, so many people calling up, and
Yes.
asking about your status and what you're about to do, and are you home quarantine and things like that and all. But then I stay in a rented place at the moment, so and by myself. So for my daily routine and food and all that, I had to um, depend on somebody when I was really unwell. So I thought
Okay.
it was best to just move to a hospital, so at least things are taken care of that way. Of course, many people have home quarantined also. If they're staying with the family, they take this one room and they isolate themselves in that, and they've managed that way, right? So vitamin C again played a very big role. Vitamin C and other vitamins,
Okay.
which help you keep your system strong and going. Okay. And so yeah, so I landed up at the hospital. 1 or 2 days the symptoms were there. So 24 hours I'm on the bed, and and the symptoms also start going down. And I'm just looking at my phone. There was a TV there, but I wasn't interested. I'm looking at my phone, and then I suddenly start seeing these stand-up comedies. For
Okay.
many months or years, I think this trend started a couple of years back. Stand-up comedies
Huh.
here. But I've always wanted to, watch one or attend one or something like that. I was like, this is like the perfect time. Let me just check out some short
Huh.
10-minute, 20-minute, 15-minute clips. I was
Okay.
just so seeing them. So that happened for another 1 day or 1.5 days or something like that. And after that, I was like, I can't, sit and do nothing here, because I can't go back, because the symptoms have to go down, and then you need some n number of days after your symptoms to have fully gone down for the hospital to let you back in,
Yes.
to consider everything to be a safe situation,
Safe. Huh.
for wherever you go back. So that is when I actually, looked up how I can help out other people. Now that I went through this experience, and it was creating so much panic, and then mental health issues in so many people because of job losses, relationship issues, anxieties, fears, so many things. When if there is even something underlying in a pressure situation, these can surface, right?
Yes.
What happens in our daily routines is that we may not address a lot of our mental health challenges, because the daily routine keeps us going, and then we do little things to keep our stress in control. But then when there is a larger pressure that looms and affects us, that's when these things can emerge. Okay, so a lot of people saw that happening. So I thought to myself, being a counselor and volunteering with one particular organization, Helping Hand Banjara Academy, since the beginning of this year, I thought, let me reach out to more people and see what I can do. And then I contacted this Mental Health Foundation for India, where they had this online program, basically,
Okay.
telecounseling, and maybe a video call and things like that, for people who are under stress during this COVID outbreak. So
Okay.
I contacted them, and then we had an interview, and then I was chosen to continue for the counseling. So I've been working with them also.
So that's
So that
really
was
nice.
one. Yeah, that was one. It was called the Mental Health Care Online Program.
Okay.
So that was one. And then there was also another one that I came across called Step One Initiative, which was linked with the medical helpline, the government's medical helpline 104, which I'm not sure many people might be aware, but it's in Karnataka, and also many other states. It started off in Karnataka, but then it was also continued in many other states in India. So there they needed counselors during this particular phase, because there were a lot of people contacting these numbers and seeking, counseling regarding their, mental health states. It could be COVID related or otherwise. Okay, so there were doctors on board also, psychiatrists and others in that entire team. So I was playing the role of the counselor there, one of the many
Okay.
counselors who were helping out. So a few days in a week, I would give some time in the morning, couple of hours to attend calls and help them out with what they were dealing with. And so these two initiatives, as soon as I tried out and got on board, that's when I really felt like I was contributing and making some difference in some little way at least.
Yes, yes.
Because I mean, work could wait for some time because I had to still fully get well. But there was something itching in me to right away start. And when the symptoms are down, I don't want to be lying the whole day. And that is when they started. And in that little way, I could consider myself one of the many warriors. Um, so thank you so much for that. And that has been continuing. So I've been continuing to volunteer and counsel people who've been contacting these
Okay.
organizations.
Yeah.
And it,
Sorry to interrupt
yeah,
you, Arjun.
sure, sure,
I
sure, sure.
just want to check, how did your family and your neighborhood react to this?
Yeah,
Because we keep
yeah,
reading and seeing people
yeah, yeah.
having to face so much of stigma around, right?
Yeah, yeah,
So
true.
how was it
So,
taken?
so yes. At the very beginning, I didn't announce it to everybody, of course, because you don't want everybody to panic and relatives
Yes,
and all that. You want at least things to be in go in the right
place. Huh.
pace and sit in the right places, and then you might want to inform people. Otherwise, it's just unnecessary panic when you yourself don't know what are the next immediate steps, right? So I just informed my father, my parents basically, and so basically we also were aware of certain hospitals which had facility available for recovery. Okay, so I went ahead and joined one of them. There was also the BBMP who was calling and saying, you know. Um, it came as in a little bit of a shock because they came all of a sudden and they were like, ಅರ್ಜುನ್ ಅವರೇ ಬನ್ನಿ ನಿಮ್ಗೆ what is that ರವಿಶಂಕರ್ ಅವ್ರ ಆಶ್ರಮಕ್ಕೆ ಕಳಿಸ್ತಾ ಇದೀವಿ. I'm like,
Yake.
excuse me, just a second. Hold on, just a minute. I'm really unwell. My back is really hurting. I think I might need more than just an ashram for that. So, I mean, maybe people who are in a better state, where things are more in control, they just need a place to isolate and can manage. But at that point, I think I thought I needed more than that. So I was like, no, no, I've just called somebody. The ambulance is on the way, and I went to a hospital actually.
Okay.
And the neighbors, of course, actually in the same building, there was another person who had contracted just before me.
Okay.
So they had barricaded the in the neighborhood just around the building.
Okay.
Okay, so there was already this thing going on the street that it is a COVID restricted area, and movement is prohibited through that. Okay, so that was going on, and then I contacted after that. So that person also left to the hospital. I also went to the hospital. So yes, of course there was commotion. Of course there were people standing in their balconies, and when the ambulance comes, and it's like a I don't know, DDLJ sort of I don't know, Simran sort of a farewell sort of a thing going on. Everybody's looking from balcony. What is happening? What is happening? Oh, we have somebody going and all that.
Yeah.
But then again, BBMP people also, I'm sure they're doing great work, and sanitizing areas, and then making sure at least some processes. Of course, there'll be flaws, okay, but making sure that things go smoothly, right? Otherwise, as they say, even though there are no symptoms, you could be a carrier of corona, right?
Yes.
So it's not necessary for me to sneeze or anything like that, but it could be other little contacts, and other people could get unnecessarily affected. So taking those kind of measures becomes really important. I'm sure masks and sanitizing is something, social distancing is something everybody is doing, but then there are also little things like contactless delivery, right? When you're
Yes.
ordering things which come over, if you can just pick that one thing of contactless delivery, they're placed, and then there's no immediate transmission, immediate contacting happening. Or some restaurants that I saw who are offering this contactless ordering, where the menus are on the table, or there's a scanner, you just look at that and then you order. So dishes and all, of course, are washed, but then the menu card, if you think about it, is something
Yes.
that everybody's touching, person to
Yes.
person, hour after hour. A lot of people are touching.
Yes.
So little initiatives like that from a lot of people can make a lot of difference. Goes a long way.
Yeah, that is actually
So
happening now.
yes, yes, yes,
And generally,
yeah, and
people
then
pre-order also.
yes, yes. Yes, and then also the family was very supportive. Of course, I had a little puppy that time, so I just needed them to take care of that for that
Okay.
time, and I there was nobody else at home, so I could go and rest at the hospital for to recover.
Okay.
And yeah, so the family was of course supportive through the process, and
Uh, anything,
yeah.
anything that would you like to inform the audience, like something which we have to be very cautious about
Hmm,
from your experience or from your learning? Like
hmm, yeah.
it is like,
So
see,
so
like mask and sanitizer obviously
yes,
is
yes,
mandatory
yes,
now.
yeah.
But apart from that, what would
Yeah.
you
So what
really
has
say?
happened now is there's a sort of an inertia that has come with this, mask and sanitizing hand. Initially, everybody was doing it all well. A lot of people have started relaxing a little bit, is taking a little chances, but still matters. All these things still matter in your, local neighborhoods and things like that. So taking it easy is just allowing for more risk. And even I can't, because I was not really going out that much. I was also, I mean, lockdown was in place and all that. I was pretty much at home, and but still, I contracted it because it's happening at a large scale. It could
Yes.
be a very small way in which you come in contact with it. So things like, whenever you're passing things on, little things matter, because this keeps happening every day. You keep sanitizers for whoever is coming in at your place, leaving. Encourage other people. There could be people who could be, missing out on doing those, so just encouraging them, because not everybody might have the stamina to keep doing it all the time.
Yes.
If
Sometimes.
you really look into that, right? Yes, we know we have to do this and all that, it's all there, but then to actually do it day in and day out, and to help each other out. And so that is something which is actually the taking care of the sanitizing, and the little spaces that I work with, for example, just helping them out with a foot press sanitization stand, right? So
Yes.
that there's no need for the hand also to come in contact with it.
Contact.
So your
Yes.
feet comes and presses it, and then you're clear. So how many ever people use it, you're not that worried,
Yes.
right? Little things. So initially everybody started using a sanitizer and using their hands, and then somebody else uses it. So there's some entanglements going on there.
Yes.
Yeah, so like you say, I mean, everybody's waiting for the vaccine, and they say that US and developed economies will have the herd immunity somewhere by 2021, third or fourth quarter. So it's all the little measures that we need to be taking. Okay, although the systems are opening up, economies are opening up, it's still important. Just because the government opens up, whatever offices and schools and things like that, doesn't mean the corona is gone, right?
Yes.
So it is. We still need to be very careful about things. Do things in batches and rotations, and as it's been happening. So
And
so
all that
yes,
extra
I'm
care also, all the
yes,
time.
yes, yes, yes.
Because
So yeah,
so thank you so much, Arjun, for sharing
more
your
than glad to be here.
experience.
Yeah,
Yeah, thank you so much. Like you
yeah,
came forward and explained. There's
yeah.
somebody here on chat. Their message. Many people out there are not maintaining wearing the mask properly, and looks like COVID fatigue has set in. People's efforts
Yes,
are slackening, and what can be done to drive home each person individual's responsibility? So any
Yeah,
thoughts on
yeah.
that?
So it is a very valid question in the sense that at least I would say with respect to that, um, if I had to generalize, right, I would say India is still in a better place because there are all
Yes.
these anti-mask factions going on in so many places. You know, we are stopping our right to live and breathe and whatnot. The some people just may not. So it's also about being careful with how you use the mask, right?
Yes.
If you're just putting on one and then there's contact all over, or not keeping it clean, or just
Yes.
wearing it somewhere else, or all of those other things, there is still potential, right, for the
Yes.
corona, right? So it's not just about putting something on that looks like a mask on you, right? We have to look at the
Yes.
functionality of it also.
Yes, exactly.
So that is there. And as the person mentioned, of course the fatigue is there. That is when I mentioned like things like these, when people who do care about the society themselves and the people close to them, they discuss, they point out things, ideas come up. And little bit small measures of awareness, if you see a little video that talks about the awareness or how to do something right, pass it along, share it along. Don't just be a passive observer of it. That is the way things move.
Yes.
They say you are not stuck in traffic, you are the traffic,
Yes.
right? So it's not that we are just the ones who are suffering the thing going on. We are also the agents who can make a change in our own little ways,
Yes.
right? So if we are concerned about this, the next question should be, what can I do about it? Can I speak
Yes.
to someone, do a little thing, maybe just take a video and or maybe a small snap and then put it on social media and say, this is not the right way to do it, this is the right way to do it. And maybe look at some statistics, because these numbers and proofs really will help. Otherwise
Yes.
it's just words, right? So then you can actually make a little difference yourself,
Yes.
rather than wait for somebody to impose that on us, or wait for the government to impose that on the people.
Yeah. And as a society, everyone has to participate and spread the
Yeah.
awareness among the
Yes.
uneducated lot, or whoever is
Yes.
not able to, or to
Yes.
the geriatric community also, because they're still wondering what is happening, because they're not able to understand. They've never seen or heard about it, and suddenly it has come up. So
Yes.
they are still fighting to understand what it is. No, no, my children are lying to me, and nothing like this ever existed in history.
Yes.
So
To
that
denial.
community
Yeah.
also we need to
Yeah.
uh, educate properly,
Yes.
so that can
Yes.
help.
Mm.
And today being mental health awareness day, we should
Yeah.
actually give more importance to mental health, along with the precautions and other things what we are going to take for the COVID,
Yeah.
because COVID is going to stay here for some more time till we find a cure, just like the polio or any
Yeah.
other disease we had, or any other virus the society faced.
Yeah.
So thank you very much once again,
Thank you
Arjun.
so much.
Thank you
Thank
for
you so
your
much.
time. Audience, anybody, any more questions? Anyone would like to ask something?
So another thing I can
Yeah,
just
you
maybe
can add on.
suggest is that not everybody in, let's break down the society into family units. Okay, let's say one person in a family is the kind who is a little more concerned about this. We have all kinds of personalities in a group or in a collection, right?
Yes.
So if somebody is a little more careful, is a little more aware, a little more wants to take the measures towards this, that person can encourage just that little circle around them,
Yes.
their spouse, their child, or whoever, okay, their parents, just that little circle, to be extra careful, okay, with
Yes.
what exactly to do. And that itself, if it's happening in all little places, that can make so much of a difference,
Yes.
right? Instead
Yes.
of expecting everybody in our family or our small circles to know everything or be fully aware of how it impacts, what exactly is the transmission. I still remember even before the lockdown, when there were all these graphs at how, if you don't impose the lockdown,
Lockdown.
what could be the severity of it, right? How exponentially it could increase. One person looking at it in the family and then passes it on can make so much of a difference.
Yes, yes.
Yeah.
So that is again a very good information. Yeah. So let us stay safe, and we request all of you to follow what the government has to stay on this, and keep reading, keep reaching out to one another. And we want more warriors like this, like Arjun, to come forward and help the society. In spite of his health, he went out of the way, he took that extra steps to help the society, be it counseling or whichever way he was able to reach out to the society to make the best use of his time. You used your time wisely, but that definitely made a difference, and it gave importance to the mental health of that person or whoever reached out to you. So very well done job, Arjun. We are so happy and proud of you, and thank you so much. Thank you one and all. Thank
Thank
you.
you so much, Alpa. Thank you, everybody, on this World Mental Health Day. I just maybe just encourage everybody to be a little more aware about mental health issues, especially during times like these. And if you see somebody near in their one's office space, family space, wherever, just outside somebody unknown, just maybe encourage them to seek help, and that is the biggest thing one can do. Once
Yes.
somebody starts seeking help, things fall in place. But that the as they say, the kickstart can be hard, right?
Yes.
The kickstart can be hard.
Hard.
So wishing everybody a very happy World Mental Health Day. Okay, so kindly be
Yes.
aware. Please do take the necessary measures for everything.
Yes, yes, yes.
Okay, thank you.
So thank you so much. And today is also World Hospice and Palliative Care Day. So people struggling with life-limiting diseases, especially diseases like cancer or another other chronic diseases, they know along with their medical help, even emotional and psychological support from the society and the people around us is very important. So, wishing you all a very safe and uh, secure life ahead. Yeah. Thank you, one and all. Thank you.
Thank you.
Thank you.